Hello everyone. Welcome to our Medicare 101 webinar. My name is Carrie Buckley and I am part of the Buckley Insurance Group. The Buckley Insurance Group is located in Brick, New Jersey. My husband Derek and I founded the Buckley Insurance Group back in 2009. A little bit about us. We've been married for 30 years. We have 2 children, Connor and Sydney, and we are Medicare and retirement experts. In addition, we did author 2 books, one called Medicare Mistakes and How to Avoid Them, and the other is Beyond the Portfolio, Why Your Retirement Portfolio Isn't Enough, and the 4 pillars most advisors overlook. There will be more information at the end, but if you do want a free copy of these books, we'd be happy to send you one. You can just reach out to us and we'll give you the details at the end of the webinar on how to do that. So a little bit about our group. We are education focused. We have an A+ rating by the Better Business Bureau. We have over 100 5-star Google reviews. We're recognized as one of the top agencies in the nation, and we've had that recognition since 2017. We are members of the local Chamber of Commerce, and we do give back to local charities as well. And our aim is to treat you like family. So we do have, this is a picture of our staff, and again, we're located in Brick, New Jersey. So what we're going to do today is we're going to talk about Medicare. We're going to go through the basics so you have an underlying foundation and education about Medicare. Essentially, we're going to do a Medicare 101. Okay, the first thing we're going to talk about is original Medicare. So original Medicare is made up of Part A and Part B. Okay, Part A is your hospital coverage. So that covers anything inpatient hospital or inpatient skilled nursing. And there is no monthly premium for Part A. It is premium free as long as you and or a spouse have worked for 10 years or 40 quarters and paid into Medicare taxes. If you've satisfied that requirement, then there is no cost to Part A. Medicare Part B is your medical coverage. So that would be anything not inpatient hospital. So that would be lab work, doctor visits, MRIs, CAT scans, outpatient surgery, emergency room. Anything not inpatient hospital falls under the Part B medical. Now Part B covers 80% of your medical expenses, and there's an annual deductible this year of 2026 of $283. Now Part B is not free. Okay, Part B is based on your income. We'll get to the income requirements in a little bit, but the base monthly premium for Part B is $202.90 a month. So here's about the Part B premium. When you are going on to Medicare, Medicare will do a 2-year look back at your tax return from the prior 2 years, and they look at the modified adjusted gross income from that tax return to determine your Part B premium. So if you are going on to Medicare in 2026, they will look at your 2024 tax return, again at the modified adjusted gross income, to determine your Part B premium. So as you can see from the slide, if you file your taxes jointly and the modified adjusted gross income is $218,000 or less, or if you file individually and the individual income is $109,000 or less, your Part B premium will be $202.90 a month. If your income is higher, then you can see from the slide it falls into different brackets. And depending on what bracket you fall into, that would be your monthly respective Part B premium. Now, if you do fall into a higher income bracket, also know, in addition to your Part B premium being higher, you're also going to get a high income surcharge on your Part D prescription drug coverage as well. Okay? Now, if you've had a qualifying life event since they looked at your tax return, so let's take 2026 for example. If you're filing in 2026 and they're looking at your 2024 tax return, let's say you retired in 2025 and that caused your income to drop in 2025, you can appeal the Part B premium determination based on that qualifying life event of retirement. So if your income did change within that 2-year look-back window that they do, you do have grounds for an appeal if there's a qualifying life event. All right, so when should you enroll? These are your enrollment scenarios into Medicare A and B. Well, if you're currently receiving Social Security, you're going to be automatically enrolled in Medicare A and B about 3 months before you turn 65. If you're not receiving Social Security, then you will have to physically enroll in Medicare A and B. And if you're still working and covered by employer insurance, either for you or through a spouse's employer, you would also have to physically enroll. We're going to go a little bit more in depth into these. So, if you're currently receiving Social Security benefits and you're turning 65, you are going to be automatically enrolled in Medicare Parts A and B. You're going to receive your ID card about 3 months prior to your 65th birthday. And that Part B premium, the $202.90 or whatever your Part B premium is, will begin to be deducted right from your Social Security check the month of your 65th birthday. If you're not collecting Social Security and you're turning 65, you must manually enroll in Medicare. And you do that by going to the ssa.gov website and enrolling in Medicare. Or you can call and enroll over the phone, or you can use agents like ourselves. We can help assist you with enrolling in Medicare as well. Now, if you are not collecting Social Security and you enroll in Medicare Parts A and B, you will be billed quarterly for your Part B premium until you start collecting. Once you start collecting, then they will take that Part B premium right from your Social Security check. If you're still working and you're covered under your employer plan or a spouse's employer plan, you are going to want to gauge whether you need Medicare or not, okay? In most cases, the general rule of thumb is that if your employer or your spouse's employer has 20 or more employees, generally you can defer Medicare Part B if you're going to remain on that insurance, okay? So if you're working and you have insurance through an employer and it's greater than 20 employees, we always recommend you check with your HR or your benefits person, but general rule of thumb, 20 or more employees, you can defer Part B if you're going to stay on your employer or your spouse's employer insurance. Now, that brings into play, do I enroll in Part A? If you have a regular medical plan through an employer, you can enroll in Part A only. Remember, Part A has no monthly premium, and it just kind of sits in the back of your employer insurance. It doesn't really do anything. It doesn't interact with your insurance. But you have Part A set up so that later on when you need Part B, it's easier to enroll in Part B because you'll have your Medicare ID number. Okay, so if the employer has less than 20 employees, most often you need to enroll in A and B. And then what happens is that Medicare becomes your primary and the employer coverage becomes the secondary. Okay, so in that scenario, you're going to want to compare coverage and costs to Medicare. All right, so just to recap really quick, covered on employer insurance. If you have group insurance and you're going to keep it and it's 20 or more employees, most likely you can defer Part B. If it's a high deductible health savings account plan, HSA plan, you don't want to enroll in Part A when you turn 65. There are tax implications of enrolling in Medicare Part A and having contributions to an HSA. So if your plan is an HSA and you're turning 65 and you're staying on it, we do not recommend enrolling in A or B. If it's not an HSA, you can enroll in A only. If it's less than 20 employees, you are going to need to enroll in A and B. So if you are contributing to an HSA, they do recommend that you stop contributions to your HSA about 6 months prior to enrolling in Medicare Part A. So there are certain enrollment periods throughout the year. The initial enrollment period when you're first turning 65, a general enrollment period. If you miss the initial enrollment period for any year, at any reason, you have another chance to enroll. A special enrollment period, the annual enrollment period, and the Medicare Advantage open enrollment period. I'm not going to get too into the weeds with this, but we'll go through each of them briefly. If you're in your initial enrollment period, that means you're turning 65. You have 3 months prior to your 65th birthday, the month of, and 3 months after to enroll in Medicare A and B. If you miss that enrollment window for any reason, you do have another opportunity to enroll, which is called the general enrollment period. And that runs every year from January 1st to March 31st. Your Medicare eligibility, you would be enrolled the month after you do the physical enrollment. But if you enroll during the general enrollment period, you will incur a late enrollment penalty. So you do want to try to avoid enrolling in through the general enrollment period. So special enrollment period, if you've had employer coverage and you've deferred Medicare Part B, you can enroll anytime you're ready to leave your employer insurance, anytime during the year. That gives you a special enrollment period when you're losing employer coverage. The annual enrollment period every year runs from October 15th through December 7th. This is for people who are already enrolled in Medicare A and B. It allows you to make changes to your Part D prescription drug plan, or if you have a Medicare Advantage plan, it allows you to change that plan as well. And then there's another open enrollment period called the Medicare Advantage open enrollment period, which runs every year from January 1st to March 31st. During that time, you can only change from a Medicare Advantage plan to a different Medicare Advantage plan, or you can change from a Medicare Advantage plan to a Medicare Supplement plan. And we will get into these plan options and how they work later on. These are just your general enrollment periods throughout the year. Okay, so Medicare enrollment, Part A and B. Your coverage begins the first day of your birthday month. So if your birthday is August 15th, Medicare would be effective for you on August 1st. If your birthday is the first of a month, so if your birthday is on April 1st, you get a whole nother month of Medicare eligibility. So you would be eligible for Medicare A and B effective March 1st of your birthday year. So Medicare A and B don't cover everything, okay? So these are some of the exposures that you have that you are responsible for if you only have Medicare A and B with nothing else. If you only have Medicare Part A, there is a $1,736 deductible per hospital occurrence, okay? And again, Part B covers 80% of your medical expenses, and there's an annual deductible of $283. So that 20% that Part B doesn't cover has no cap on it. So if you only have A and B, you would be responsible for 20% of all of your medical expenses with no cap. So this is where people choose to pick up some additional coverage. You can either pick up a Medicare Supplement plan, which is also called Medigap, or a Medicare Advantage plan to pick up those pieces that Medicare A and B don't cover. We're going to go through both of these roads. So you can only take one road or the other, either Medicare Supplement or Medicare Advantage. But regardless of which road you take, you still need to have Medicare A and B in place, okay? So if you took a Medicare Supplement plan, you would have A and B, then you would take a Medicare Supplement or Medigap plan, and you would additionally need a Part D prescription drug coverage plan. If you decided to take a Medicare Advantage plan, you would still have A and B, and then the Advantage plans are also called Part C plans. And what they do is they combine A and B, and most cases they also combine Part D. They have drug coverage built into them as well. All right, so let's compare the two. With a Medicare Supplement plan, you have to pay your Part B premium, which is $202.90 a month, or if you have that high income, whatever your determination is. Then there's a monthly premium for the Medicare supplement plan. And that premium depends, it varies by age, gender, and state, okay? With these plans, you can use any provider, any doctor, hospital, facility, anywhere in the United States that accepts Medicare. No networks, no referrals. As long as someone takes Medicare, they will take your supplement or your gap plan, regardless what carrier it's with. And these plans give you the lowest out-of-pocket costs when seeing doctors or using hospitals. And again, you would need a standalone Part D prescription drug plan in addition to a Medicare supplement plan. Also, Medicare supplement plans do not include any type of dental, vision, or hearing coverage. So you would need to pick up those as well with a Medicare supplement plan. On the flip side, a Medicare Advantage plan. Still have A and B, still have your Part B premium, okay? With these plans, Medicare no longer is your primary insurer. The private carrier becomes your primary insurer. So they work like HMO or PPO plans, where you have to stay within a defined network, okay? These plans are lower to no monthly premium. There could be zero premium plans in your area, okay? However, there are copays and coinsurance associated with every single service that you get. So, for example, on a Medicare Advantage plan, primary care visit would be one copay, specialist would be another copay. If you're an inpatient in the hospital, you would have a copay of a couple of $100 a day for a certain amount of days, depending on the plan that you choose. In the case of more advanced services, like if you needed chemotherapy or if you needed injections in your knee, you would pay 20% of the cost of those services up to a maximum annual out-of-pocket. And the maximum annual out-of-pockets range, they vary depending on the plan that you choose. Typically, Medicare Advantage plans include the prescription drug coverage, so you don't need a separate Part D plan. And some of the plans also include some limited dental, vision, and hearing coverage. They can include over-the-counter benefits and gym membership benefits. But don't forget, these plans work like HMO or PPO plans. With an HMO plan, you cannot go out of network, you have no coverage. And with a PPO plan, you can go out of network, but at a higher cost share to you. So there are network restrictions on the Medicare Advantage plans. Okay, so this is just a side-by-side comparison. Again, Medicare supplements, A and B, monthly premium for the plan, the Medicare supplement plan, monthly premium for the Part D prescription drug coverage. However, you can use any provider anywhere in the United States that accepts Medicare, no networks, no referrals. Medicare Advantage, again, you need A and B, but the private carrier becomes the primary. They're lower to no monthly premium, but you do have copays and coinsurance associated with every service that you get. They do have a maximum annual out-of-pocket cap. Most of them include prescription drug coverage, and some of them include additional benefits like gym, over-the-counter, dental, vision, hearing. So Medicare, that being said, Medicare is not a one-size-fits-all. You know, what your cousin has or what your mom had or what your friend has, that might not be the best coverage for you. You need to tailor your coverage to your individual needs, your health, your finances, and everything like that that's going on in your life. You need to tailor your coverage to make sure you're comfortable and that it fits your needs. Whether you take a Medicare Advantage plan or a Medicare supplement plan, even with the Medicare supplements, you still can have some exposure in the case of a cancer diagnosis or a heart attack and stroke diagnosis. So there are additional policies that you can get to cover the costs of those other outlying issues and the exposures that they would cost you. And we will get into this a little bit later, but just so you know, whether you take Advantage or supplement, there are other layers of coverage that you can add to your policies to help you get complete coverage. All right, skilled nursing. So most times with skilled nursing, you have to be in the hospital for 3 days and then you get transferred to a skilled nursing or a rehab facility. Days 1 through 20 are zero copay. However, on some Medicare Advantage plans, you do have a copay for those first 20 days. So you'd have to check that on your plan. And then days 21 to 100, you would have a copay of $217 a day each. With a Medicare supplement plan, that would pick up days 21 to 100. So you would have zero copay in a skilled nursing facility on a Medicare supplement plan until day 100. Okay, so there is a great handbook online called Medicare and You. This is the 2026 version. This talks about skilled nursing. The only thing I want to bring to your attention is sometimes you need to distinguish between being an inpatient and an outpatient, especially with Medicare Advantage plans. If you are being held in an observation status, you're not considered an inpatient. So you would have to pay the outpatient copays for the Medicare Advantage plans. So it's important to know when you're in a hospital and you're in an emergency room, you need to know so you know what your responsibility will be as far as costs. Are you an inpatient? Are you being held in observation and an outpatient? So the Medicare and You book details that, and it goes in depth on the skilled nursing coverage as well. All right, let's go back to Medicare supplement plan. Again, Part A, you'd have the $1,736 deductible each hospital stay. On a Medicare supplement plan, it covers that deductible. So if you're hospitalized, you're covered at 100%. It covers the 20% of Medicare covered expenses, medical expenses, after you meet the $283 deductible. So on a Medicare supplement plan, no Part A deductible, that's not your responsibility, and the Medicare covered medical 20% is not your responsibility once you meet the $283 deductible. So it's very comprehensive coverage. Okay, and again, with Medicare supplement, you have A and B, you have the Medicare supplement or Medigap plan, and a prescription, Part D prescription drug plan as well. Again, it's called Medigap. You can use any provider anywhere in the United States that accepts Medicare. No networks, no referrals. So these are a list of all of the Medicare supplement plans that are available. However, we narrow it down to the two most popular and comprehensive Medicare supplement plans, and that would be Plan G and Plan N. With Plan G, you would pay a monthly premium. You would pay the Part B deductible of $283. Once you meet that deductible, all the rest of your Medicare covered expenses are covered at 100%. The other most comprehensive plan is Plan N. With Plan N, you also pay a monthly premium. You also pay the Part B deductible of $283. In addition, you would have copays of up to $20 when you see a physician and a $50 copay for the emergency room if you're not admitted. In some states, you also, with Plan N, would have Part B excess charges. And Part B excess charges in the past have been extremely rare. However, if you see a provider, again in certain states, that does not accept Medicare assignment, which means they don't agree to Medicare's payment terms, in those cases, they're allowed to charge 15% more than the agreed Medicare rate. So on Plan N, only if you see someone who did not accept assignment, you could have some additional charges. Obviously, Plan N's premiums are lower than Plan G because you have a little bit more exposure on Plan N, a little bit more out of pocket with the copays and the possibility of the excess charges. Okay, so again, Plan G, monthly premium, which varies based on your state, your gender, and your age. And the only thing you would be responsible for is the $283 deductible after your monthly premium. And then once you meet that deductible, all the rest of your Medicare covered expenses are covered at 100%. Plan N, same thing, monthly premium. Monthly premium would be less than Plan G, but again, it varies by state, age, and gender. You do have the deductible of $283, and you do have the copays of up to $20 when you see a physician, and the $50 copay for the emergency room if you're not admitted, and then the possibility of those excess charges. So the best points about Medicare supplements. The best time to enroll is if you're enrolling in Medicare A and B, you'd want your supplement to start when your A and B is starting. So that would be 3 months, again, prior to your 65th birthday, the month of, or 3 months after. You want to enroll as early as you can to get the best rates. And they are federally regulated. So a Plan G with one carrier is the same exact coverage as Plan G with another carrier. So you definitely want to make sure you shop around for your Medicare supplement or your Medigap plan. And as agents, independent agents, that's part of a service that we do for you. We look at all the major carriers in your area and we compare the rates, because one carrier can charge X amount of dollars for Plan G, and another one can charge $10 to $15 more a month for Plan G for the same exact coverage. So you want to make sure you shop around for the best rates. They can charge different rates for the same exact coverage. As we said, Medicare supplement plans do not include dental, vision, or hearing coverage, and they also don't include prescription drug coverage. So you would need a standalone Part D prescription drug plan as well. A lot of people ask, I'm not taking any medications. Do I still need to have a Part D prescription drug plan? My answer would be, you don't have to enroll in a Part D plan, but if you don't enroll in one when you're first eligible, you will incur a penalty for your time not enrolled, and that penalty will follow you for life. Now, if you're a veteran and you have VA benefits, you do not have to enroll in a Part D prescription drug plan, and if you do decide to enroll in one later, there would be no penalty for you. So again, you'd have A and B, a Medicare supplement, and a Part D prescription drug plan. So how prescription drug plans work. There are different prescription drug plans out there which are all regulated by Medicare. They're Medicare Part D prescription drug plans, and different carriers offer these plans. Each plan offers a list of drugs that they cover. Not every carrier covers every medication. So that list of drugs is called a formulary. And what they do is they take the medications on that formulary and they break them into tiers. The higher the tier, the more expensive the medication. So when you're picking a Part D prescription drug plan, you want to make sure that your medications are covered under the plan's formulary, and you're also going to want to know how much your copays are going to be for those medications and which pharmacies are considered preferred. Some of the plans partner with certain pharmacies to give you better cost sharing. So in the past, you might have heard of the coverage gap, this big hole or donut hole that people had fallen into when they were taking expensive medications. The coverage gap has now been phased out. It's been sunset. There is an annual out-of-pocket maximum on prescription drug coverage of $2,100. That means the most you will ever spend in 1 year on your medication copays is $2,100. You'll never pay more than that, regardless of how expensive the medications are. And a lot of the Part D plans now have a senior savings program where they regulate the cost of certain insulins to $35 a month. So if you do take insulin, you do want to try to make sure you get onto a Part D plan that offers one of those insulin savings programs. And again, you can use an agency like ours. We take your medications, we run them through the system, and we give you the options that will cover your medications the most cost effectively. So I talked a little bit about the Part D enrollment penalty. This just explains how Medicare calculates that Part D. So what they do is they multiply 1% of the national base beneficiary premium by the number of months that you were eligible to be in a Part D plan but didn't enroll. And then what they do is they round that result to the nearest 10 cents, and then they add it to the monthly premium moving forward once you enroll in a Part D plan. So let's say you miss 60 months and the national base premium is $50. The calculation would be 1% of 50 times 60 months which would be $30 per month penalty. So that follows you for life, and they will add that additional penalty on to the premium of the Part D plan once you do enroll. So that's why even if you're not taking medications, it may make sense for you to still enroll in an inexpensive Part D plan to avoid this penalty later on. And again, here's our process that we help. We help you input your drug list into a personalized Medicare link, Medicare RX link. You choose your pharmacy, and then our system gives you options as to which Part D plan covers your medications the most cost effectively. And we always urge everyone to reevaluate their Part D prescription drug coverage every year during that annual enrollment period that we talked about earlier, that October 15th through December 7th. That's your window each year to change your prescription drug plan. And you should always do that because every year the prescription drug plans change. They change their formularies. Your drug that was covered this year might not be covered next year. This year it could be a tier 2. Next year it could be a tier 3. So every year during that annual enrollment, you want to make sure you're still on the best drug plan for the following year. Okay, I think we went through all that. Now we're going to talk about the Medicare Advantage road. Okay, so if you don't want to take a Medicare supplement with a Part D prescription drug plan, the other option you have is a Medicare Advantage plan. Okay, Medicare Advantage plan, again, you must have Parts A and B. This is a managed care plan, which means the private carrier becomes your primary, not Medicare. So they are HMO or PPO plans, where you have to stay within your network to keep your costs low. You have to pay Part B. These plans are low to no monthly premium. There could be 0 monthly premium plans in your area. And however, being that they have no premium, they do have copays, coinsurance, deductibles, and an out-of-pocket maximum. Okay, and in addition, some of these plans include prescription drug coverage, and some include some dental, vision, and hearing, over-the-counter, or gym benefits. We always recommend with a Medicare Advantage plan that you pick up some additional policies. We'll talk about them a little bit later, but we want to talk about cancer coverage, hospital indemnity coverage, heart attack and stroke coverage, because on a Medicare Advantage plan, if you get these diagnoses, you are going to have much more out-of-pocket costs associated with that on an Advantage plan. So how do you choose a Medicare Advantage plan? Well, you need to have Medicare A and B. You need to live in the plan's service area. And then you want to pick a plan that has your doctors, hospitals, facilities in network, and one that covers your medications the best as well. And then if anything else is important to you, like gym membership or dental, you want to pick a plan that also includes those benefits. And again, when do you sign up for a Medicare Advantage plan? Well, again, when you're turning 65 during that initial enrollment period, you have the opportunity to enroll in a Medicare Advantage plan. Or every year you can enroll in a Medicare Advantage plan during that annual enrollment period, which runs from October 15th through December 7th. And then you can change a Medicare Advantage plan again from January 1st to March 31st during that Medicare Advantage open enrollment period. You can change from a Medicare Advantage to a different Medicare Advantage plan, or you can change from a Medicare Advantage to a Medicare Supplement plan. All right, so compare the two again, just a brief overview. Medicare Supplement, A and B, comprehensive coverage, Plan G or N, prescription drug coverage. Can use any doctor anywhere in the United States that accepts Medicare, and pretty much comprehensive coverage. Medicare Advantage, A and B, lower to no monthly premiums, but copays, deductibles, coinsurance. Must stay within your network to keep your costs down. Part D prescription drug coverage is typically included, and they have those additional benefits like dental, vision, and hearing. Just really quickly, If you take a Medicare supplement plan, in certain states, if you want to change your Medicare supplement plan, you can do that at any time during the year. However, in certain states, in order to change, you need to pass medical underwriting, which means that you have to answer medical questions on an application. And if you can't pass medical underwriting, you could be denied on a Medicare supplement plan. Same thing with an Advantage plan. If you want to change from an Advantage plan to a supplemental plan, so in a lot of states, you would need to pass medical underwriting in order to get onto a supplemental plan. So that's why it's very important to choose your initial coverage, understanding all the guidelines and the rules if you do want to change down the road, to make sure you can and you'd be able to change. Okay, these are the umbrella packages that we talked about. Okay, so there are different packages that you can sign up for. One would be just to add dental coverage or dental and vision. The next step up would be to add dental with cancer, heart attack, and stroke. These policies, the heart attack and stroke and cancer, pay you lump sum payments should you get a cancer diagnosis, or if you get a heart attack or a stroke, you can use that lump sum money for anything. So transportation to the hospital. If you need a medication, a cancer medication that's not covered by the drug plan, you can use that lump sum payment to pay for the medication. Let's say you have a stroke and you need to install ramps. Maybe you're in a wheelchair and you need a ramp installed in your house for access. You can use those lump sum policies to pay for those incidental or extra costs that you would incur. And then finally, the Platinum package, you could also look at long-term care and short-term recovery care. So if you're in a skilled nursing facility, it would pick up some of the costs there. If you needed long-term care, Medicare does not pay for aids in the home, home health aids and things like that. You can pick up long-term care policies to help with those coverages. So these are different packages that we offer. We can mix and match, whatever would be based on your needs. So here are a few common myths. If I want to use a broker like you, Carrie, I have to pay a fee to get help with all this. That is not true. We charge no fees for our services. We get compensated through the carriers, so whatever plan you choose, we get compensated through there, so there is no fee for us to assist you. Nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. Again, that is not true. We're legally charged the same rates that the carriers charge. We're not allowed to pad any expenses or anything like that. Whatever premium the carrier charges, that's what we charge as well. And if you get paid by the insurance companies, you must have a bias towards one company or the next. We have access, we're independent agents, so we have access to multiple companies, and that is not the way we operate. We do what is best for our clients. We do what's best for you based on your needs, your health, and your finances. And we present you with all the options, and we let you make that educated decision. So the truths, again, of using a broker: no fees. The price you pay to the insurance company is the same as if you would use us, and there's no bias. In addition, if you use us, you have us to call if you ever have any claim questions, billing questions, policy questions, if you want to review your policies, if you want to add coverage. You have an agency with people here that answer the phone and can help you and work with you on all of those questions. You don't have to call the carrier directly, be on hold forever. Our office facilitates all that for you. At this point, I'm going to introduce Derek. He's going to talk about retirement and protecting your money. He is unfortunately not available in person, so he is going to come in voiceover. He's away at a conference right now, so he's going to take over virtually, and then I'll be back at the end.
Thank you, Carrie, and I am sorry I cannot be on camera with you guys today. Before we wrap up our webinar, I'd like to briefly share my background, because healthcare decisions and retirement money decisions are closely connected. I began my career on Wall Street in the bond markets. I worked in New York, London, and Hong Kong for HSBC Bank. There, I was trained to manage risk, anticipate market volatility, and respond quickly to economic changes and unexpected events, such as 9/11 and the COVID-19 pandemic. That experience shapes how I approach retirement planning today. I now use those skills to help clients plan for long-term stability and growth. During our working years, ROI usually means return on investment. It's about how much our portfolio grows each year. But in retirement, ROI needs to mean something different. In retirement, the most important ROI is reliable, ongoing income. These are the accounts most people use to save and invest: employee retirement accounts, IRAs, brokerage accounts, savings accounts, and CDs. Some are ideal for building wealth while you're working, and liquid accounts, like savings, are important for emergencies and short-term needs. But retirement changes the goal. Many of these accounts were built for growth. They were not designed to create reliable, ongoing income, and they don't protect principal once you retire. Instead of predictability, they come with market volatility. Volatility was part of my world as a trader, but it's not something I want clients depending on for their monthly retirement income. Once we see how your portfolio is structured today, the next step is making sure it's built for this next phase of life. Your money now needs to do 3 things. First, protection. As we get older, large market losses are harder to recover from. That's why we use strategies that protect part of your money during market drops. Second, growth still matters. Retirement can last 25 years or more, so we look for growth with guardrails, participating in opportunities without taking full market risk. Third, income. This is the biggest shift. It's no longer about building a portfolio. It's about building a paycheck. This is where we help create your own personal pension, turning part of your assets into guaranteed income for life. For you and your spouse, guaranteed income reduces stress, and it gives you confidence knowing that no matter what the market does, your lifestyle is protected. As we wrap up, notice how Medicare and healthcare products connect directly to income, long-term care, and taxes. That's why we take a health and wealth approach. Retirement planning isn't just about investments. It is making sure everything works together. When people come to us for Medicare guidance, the conversation often expands into broader retirement planning questions. Our goal is simple: to make sure your healthcare decisions align with your overall retirement goals. Thank you for taking the time to learn how our process supports that. Carrie, I'll hand it back to you to walk everyone through the next steps and how we can help you move forward.
Thank you, Derek. So here's the phases of what we do next. Phase 1. Today's educational seminar was presented to you by us, the Buckley Insurance Group. If you want a free copy of either one of our books, you can absolutely reach out to us. Our contact information will be on the next page. The next thing is to schedule your no-fee consultation with us so we can go through your situation, get your timing for Medicare under control, get you a timeline, help you choose a plan, see what's best for you, and then again, our free lifetime support once you enroll through us. So we are going to, this is our information right here. It's the Buckley Insurance Group. Again, we're located in Brick, New Jersey. If you want a copy of either of our books or both, you can feel free to email me. My email address is my name. It's Kerri, Kerri, at findmedicareplans.com. And you can click on the blue link to schedule your no-fee consultation. Thank you so much, everyone, for viewing this presentation, and we look forward to working with you. Have a good day.